An ongoing battle over a healthcare provider limiting services on the city's west side continues. Today, the Illinois Health Facilities and Services Review Board voted on Mercyhealth's Rockton location discontinuing inpatient care.
Members of the state board voted 6-0 after first voting 5-2. One member abstained on that second vote. Amory Wilder listened in on the meeting. Amory, what does this mean going forward?
Well, Mimi and Eric, Javon Bay received the go-ahead to consolidate its services, and let me tell you, the decision did not come easy. Many board members said yes with, quote, great reservation. Mercyhealth will close 70 medical surgery beds at Rockton. CEO and president of Mercyhealth, Javon Bay, says they are not stopping services, but simply realigning.
We initially planned that patients needing hospital care, but who were unlikely to need advanced complex care could be hospitalized at our Rockton Avenue. But over time, we found ourselves more often than not having to transfer patients from the Rockton site to the Riverside site when the complications occur. And at Riverside is where we have the support service, mix of specialists and equipment to take care of these patients' underlying conditions.
When the idea was proposed last year, there was a push to prevent the hospital from moving its emergency services. Opposers saying it would limit the access of certain health care needs from the West Side community. Board member Antoinette Hardy-Waller echoed those concerns today.
Transferring a critically ill patient that's in ICU to another critical care unit 20 minutes away would be more critical potentially or more high risk for that particular patient that needs to be transferred, when in fact there could be med-surg capability in a community that may need it, that may not be as high acuity level.
Rockford's mayor has been against this move. In a statement, he says, "I'm glad they were concerned about this closure impacting the most vulnerable in our community. I am too. I will continue to fight for what is right for our residents in our community." A spokesperson with Mercyhealth tells me there are no med-surgical patients at this facility at this time. Eric?